All right, Barb, let's start with telehealth and how healthcare these days is just completely different.
Oh my gosh, Malou, it's a lot easier to see your provider because you don't have to find a parking spot and it takes a lot less time. But there's some things that are always the same, right? So you want to write down all the medications you take, pull them out of your medicine cabinet, and write down all of your health conditions, any surgeries you have, and make a list of questions. And that way, when you're talking via telehealth, you can also write down the answers.
Yeah, and a lot of offices are opening up these days too, right? Even for kids.
Oh, we've always been open throughout the pandemic because we see pregnant patients and the pediatric offices, the oncology, we've all been open, taking extra precautions, making sure people wear masks, taking their temperature ahead of time. It's really important for people to know that it is safe to come see your healthcare provider if you need to. Things are different now though when you come in for your annual. We'll be screening you by phone ahead of time. We'll be taking your temperature with a touchless thermometer. We'll be asking you to wear a mask. We'll all be wearing masks and PPE, and we're disinfecting like crazy, all to keep people safe so they can get the health care they need.
Yeah, don't be afraid to go to the doctor these days. Go and see your doctor if you need to, right?
That's right. You know, unfortunately, people with chest pain, symptoms of stroke, people who have asthma and can't breathe, they're afraid to go to the emergency rooms. But we're all taking precautions. Hospitals are safe places to go if you need to be seen. Do not delay.
Especially if you're pregnant, right? Pregnant women should definitely, see their doctor regularly.
Malu, I'm so glad you asked. So many of my patients say, well, should I just deliver at home? No, do not deliver at home. I want to reassure people, for people who are sick and may have COVID-19, they go to a whole different part of the hospital. They're isolated. Pregnant women, they come in through a separate entrance. They can have one companion with them, but do check with your with your hospital to see what their policies and procedures are to keep you and your baby safe.
Yeah, and like you said too, it's different when you go to the hospital or see your doctor these days. They're taking appointments differently. They're staggering them, right?
Oh gosh, that's true. So if you have to do telehealth, do call ahead of time and get that app downloaded. If you're not tech savvy, you want to practice ahead of time. If you do come in, remember, we're going to stagger your appointments. We're only going to have one person in the waiting room at a time, and then we're going to wipe everything down and disinfect. When you do come in, you'll be wearing PPE, we'll be wearing PPE, but we'll still do your exam. It's a safe time to come to a doctor's office, and we're opening up. I'm starting to see more annuals now.
Yeah, that's great. Always great advice with you, Nurse Barb. Thank you so much.
Oh, Baloo, stay safe and stay healthy, and see you next time.